Welcome back, everyone, to another edition of The Explainer. Today, we're diving into something really fascinating. We're unraveling the mystery of a Pacific plant that has absolutely captured the attention of modern neuroscience. I mean, if you've ever wondered if it's actually possible to deeply relax your body and calm your nerves without fogging up your mind, well, you are definitely in the right place. Today, we're exploring the science of Kava and looking at exactly how it calms the brain. 3,000. Think about that number for a second. We aren't talking about some fleeting biohacking trend or brand new laboratory discovery here. We're talking about 3,000 years of continuous ceremonial and social use across the Pacific Islands. We're talking Fiji, Vanuatu, Tonga, Samoa, Hawaii. That is literally 3 millennia of human history passing around this traditional earthy beverage. And for centuries, the people drinking it have insisted on this really incredible central paradox. They say Kava, quote, loosens the tongue and calms the nerves without stealing the mind. Think about how incredibly unusual that is among intoxicants. We're looking at a drink that genuinely relaxes the physical body, but, and here's the kicker, instead of dulling your cognition like alcohol might, it leaves the mind completely clear. So how is that even neurologically possible? Well, let's dive into this. Here's our roadmap for today's explainer. We're going to start with the cup of calm, then move into exactly how Kava calms the brain, analyze the clinical evidence, look at the liver safety controversy, and finally wrap up with the honest bottom line. All right, starting off with part 1, the cup of calm, 3,000 years of Pacific tradition. So to really understand this ancient botanical, we first have to look at the plant itself, Piper methysticum, which literally translates to the intoxicating pepper. Traditionally, the root is pounded into a pulp, kneaded in cold water, and then strained to create this muddy, earthy-tasting liquid that actually slightly numbs your lips when you drink it. But look, the effects of Kava are not just cultural folklore. They are pure hard pharmacology driven by specific molecules. And this brings us to a super crucial concept, the chemotype. You can think of a chemotype as a 6-digit code representing the specific ratio of the plant's active compounds. This ratio dictates exactly how the plant is going to make you feel. It's exactly why traditional Pacific practice overwhelmingly favors what are called noble cultivars for daily use. Those provide a very clear-headed, sociable calm. This is in sharp contrast to tudei, or tudei cultivars, which are much heavier, last way longer, and, as we'll see, are actually tied to some of the health risks we'll discuss a little later. Now, what's really interesting about this breakdown is the sheer concentration of power in just a handful of molecules. So while there are around 18 active compounds known as Kavalactones in the plant, just 6 of them carry about 96% of the active power in noble Kava. Molecules like kavain are the main drivers of that signature anxiety-reducing signal. So the specific ratios of these 6 compounds, that chemotype we just talked about, is literally what you're feeling when you drink a cup of Kava. Moving right along to part 2, how Kava calms the brain, the neuroscience of clarity. So how exactly does this muddy root water interact with the incredibly complex circuitry of the human brain to create that clear-headed calm? Well, the mechanism brilliantly illustrates the core difference between natural Kava and pharmaceutical sedatives. Both Kavalactones and drugs like benzodiazepines affect the GABA-A receptor, which is basically the brain's main inhibitory switch. But here is the truly fascinating part. They use completely different binding pockets on that receptor. We know this for sure because when scientists administer a drug called flumazenil, which acts as a harsh on-off switch to block benzodiazepines, it does absolutely nothing to Kava. Zero effect. So think of Kava not as an on-off switch, but more like a subtle volume dial that just gently turns down the noise in your limbic circuits. Because it works from this totally unique angle, it produces calm without that classic tolerance-independent signature that benzos carry.
But Kava definitely isn't a one-trick pony. Its effects are remarkably distributed across the brain. Aside from boosting GABA, it also blocks voltage-gated sodium and calcium channels. That actually dampens excessive neuronal firing and acts as a really gentle muscle relaxant. On top of that, it features reversible MAOB inhibition and even weakly inhibits noradrenaline and dopamine reuptake, basically nudging your dopamine tone upward for gentle mood lift. It's this beautiful multi-target neurobiology, working all at once, that creates that relaxed, sociable euphoria without putting your brain to sleep.
Okay, let's look at part 3, analyzing the clinical evidence, the honest truth from human trials. So it's one thing to see how receptors react in a petri dish, right? But what happens when we rigorously test Kava's efficacy for anxiety in actual human patients? Well, the data here is genuinely mixed.
The early data was highly promising. A 2003 Cochrane review, plus trials in 2009 and 2013, found that Kava significantly reduced short-term anxiety compared to a placebo. However, the counterweight to that came in 2020 with the K-GAD trial. This was the largest, longest, and most rigorous study to date, a 16-week trial with 171 people. The results? It found absolutely no significant benefit over the placebo. So the most fair scientific synthesis here is that Kava is a very plausible short-term aid for anxiety, but it's just not a proven long-term care for chronic anxiety disorders.
This brings us to part 4, the liver safety controversy, separating the plant from the product.
Look, we simply cannot have an honest explainer about Kava without talking about the liver. Back in the early 2000s, reports of severe liver toxicity actually triggered global bans. Now, why on earth were people getting hurt by a plant that had been consumed safely for thousands of years? Well, first let's look at the actual statistics. Clinically apparent liver injury from Kava is a real thing, but it is exceptionally rare. To put that in perspective, the National Institutes of Health estimates it at well under 1 case per million daily doses. But obviously, even 1 case is too many. So researchers spent 2 decades investigating exactly what went wrong. And what they found was a massive, massive departure from traditional wisdom. The crucial point is perfectly laid out right here in this contrast between traditional use and the modern products implicated in harm. Pacific Islanders traditionally use those noble cultivars we mentioned. They extract them in water, and that results in very low levels of a specific hepatotoxin called flavokavain B, all while retaining a liver-protecting antioxidant called glutathione. But the commercial products that cause the global panic, they use those heavier tudei cultivars, and instead of water, they used harsh chemical solvents like acetone and ethanol. These solvents literally pulled out massive amounts of toxic flavokavain B, which then depletes glutathione and causes severe oxidative stress in the liver. So it wasn't the traditional plant causing the harm at all. It was the modern, chemically extracted product.
And understanding this completely shifted the regulatory landscape. In the early 2000s, panic led to outright bans in Germany, the UK, France, and Canada. But as the science slowly caught up, the narrative began to change. By 2007, the World Health Organization officially pointed the finger at those solvent extracts, completely separating them from traditional water-based drinks. And get this, just recently, in 2024, a German administrative court actually overturned the country's ban altogether, ruling that it was disproportionate to the actual evidence. Which leads us to our final section, Part 5, the honest bottom line, where tradition and science meet.
So, where does all of this leave you, the modern consumer trying to navigate this landscape today? Here's the rundown on what you need to know about Kava as of 2026. The legal map is a bit patchy. In the US, it's legally sold as a dietary supplement, and there's actually a booming, highly social Kava bar scene popping up everywhere. Australia, on the other hand, is highly regulated, strictly capping doses at 125 milligrams of Kavalactones. On the safety front, while liver risk is incredibly rare with traditional preparations like we just discussed, chronic heavy use can actually cause a dry, scaly skin rash called kavadermopathy. Though, good news, it is fully reversible if you just cut back. And perhaps most importantly, because Kava physically dials down the nervous system, you should absolutely never, ever casually combine it with alcohol, benzodiazepines, or other sedatives. I want to leave you with a final, slightly provocative thought to chew on. Did modern pharmacology's rush to isolate and chemically solvent extract compounds make us forget the profound safety of 3,000 years of traditional wisdom? It is a pretty powerful reminder that sometimes the safest, most effective way to consume a botanical is exactly the way it's been done for millennia. Thank you so much for joining me on this explainer. I will see you next time.